Hello students, welcome to this session. Let's study circulatory system. So 2.1 cardiovascular system, 2.2 blood vessels, 2.3 cardiac cycle and cardiac output, 2.4 blood pressure and factors affecting it.
Hello students, today we will see about circulatory system. So circulatory system consists of blood vessels and heart. So we will study heart in detail. So heart is located in between two lungs in the thorax. Then coverings of the heart, there are four coverings. So here the formula of four. Four coverings: epicardium, myocardium, endocardium, pericardium. Pericardium of two layers: inner visceral and outer parietal layer, and then in between that the fluid which is called as pericardial fluid present, and it prevents it gives protection and nutrition to the heart. So four chambers, two atria and two ventricles. So two atria means left atrium, right atrium, and two ventricle means left ventricle, right ventricle. Four valves, two atrioventricular valves. So one is bicuspid and tricuspid valve, and two semilunar valves. So aortic and pulmonary valve. And functions of valves is to prevent backflow of the blood. Four great vessels: superior vena cava, inferior vena cava, pulmonary vein, pulmonary artery, and aorta. Total three circulations are there: pulmonary circulation, systemic circulation, coronary circulation. So pulmonary circulation, when there is the exchange of blood between lungs and heart, it is called as pulmonary circulation, and it takes place through pulmonary veins and pulmonary artery. Systemic circulation, exchange of blood between the body and heart. So it takes place between all four chambers and all four great vessels like aorta, superior vena cava, inferior vena cava. Then coronary circulation, it is the branches of coronary artery, that is left and right coronary arteries. They arise from aorta and then supply oxygenated blood all over the atria and ventricles. It is called as coronary circulation. So it is through coronary arteries. So blood vessels, there are few different kinds of blood vessels. So first is artery. So this is the artery which carry, so it is a blood vessel which carry blood from the heart. So it is away from the heart. So it is thick walled artery because it carry blood under the increased pressure. Then branches of artery is called as arteriole. Then smallest branches of the blood vessels is called as capillaries. Then capillaries join and form venules, and venule join and form the vein. So important great vessel is vena cava, which is formed by combination of the superior vena cava and inferior vena cava. Now we will see difference between artery and vein. So artery is the blood vessel which carry blood away from heart. Vein is the blood vessel which carry blood towards the heart. So artery carries oxygenated blood except pulmonary artery. Vein carries deoxygenated blood except pulmonary vein. Arteries are deep in location, veins are superficial. Artery wall is thick because it carries blood under increased pressure, and vein wall is thin because it carries blood under normal pressure. So arterial blood collection is used for the blood gas analysis, and mainly radial artery is used, and veins are superficial, so easily we can do collection for all biochemical and serological testing. Cardiac cycle, there are four steps in that, or stages. So first is atrial systole. So when atrium contracts, it pushes its blood to the ventricles. Then ventricle contracts, it pushes its blood to the aorta and pulmonary arteries. And then the blood is from aorta supplied all over the body, and pulmonary artery blood goes to the lungs for the oxygenation. And then atrial diastole, the atria relaxes and the blood from all over part of the body is received in the atrial chambers. So atria are receiving chambers. And then ventricular diastole. So ventricular diastole, the ventricles are ready to receive the blood from atria, and the cycle, that is cardiac cycle, continues. Thank you. Arterial blood pressure. So blood pressure is defined as the lateral pressure exerted by blood against the vessel walls. So it is of two types, systolic and diastolic. So the maximum pressure exerted when the ventricular contraction, it is called as the systolic pressure, and the minimum pressure when during the ventricular relaxation, that is diastole, is called diastolic pressure. The normal blood pressure is 120/80. That means systolic pressure is 120 mm of mercury and diastolic pressure is 80 mm of mercury. The blood pressure is measured by apparatus called as a sphygmomanometer, and when there is more than 140 by 90 millimeter of mercury blood pressure, it is called as hypertension. There are few factors which affect the blood pressure. So cardiac output, blood volume, viscosity of blood, age, sex, build, and sleep and emotion. And in pathological conditions, it is kidney disease, anemia, or high level of the cholesterol and triglyceride in the blood, that is obesity. Hope you find this session useful for your understanding and for your exams. Thank you.